Hello friends, in today's video, we will learn about stroke, its causes, types, and pathophysiology. I've explained stroke in a basic manner so that all the students can understand easily. If you like the content, make sure to like the video and subscribe the channel. Now, let's start learning. So, what is stroke or CVA? Stroke, cerebrovascular accident CVA, is the sudden loss of neurological function caused by an interruption of the blood flow to the brain. Types of strokes. Strokes are classified into three types. First is etiology or cause. Causes can be thrombosis, embolus, or hemorrhage. Second classification is based on specific vascular territory, that is anterior cerebral artery syndrome, middle cerebral artery syndrome, and so forth. And the third classification is management categories like transient ischemic attack, minor stroke, major stroke, etc. So, what functions are affected because of a stroke? Important functions of body such as sensory, motor, cognitive ones like attention, language learning, memory, perception, and thought are affected in a stroke. An important clinical tip to remember here is that to be classified as stroke, all these neurological functions would be lost for at least 24 hours. Causes of stroke. There are many causes, but majority of the cases are reported because of atherosclerosis. Atherosclerosis is a plaque formation that basically blocks the artery. Now let's discuss the type of stroke in detail. About ischemic stroke. A thrombus or emboli in an artery result in lack of cerebral blood flow, which will then lead to decreased oxygen and glucose to brain tissue and eventual death of this tissue. If a thrombus is found in any cerebral artery or its branches, we shall call it cerebral thrombus. These thrombi may remain stationary at their site or may dislodge from the arterial wall and travel to another site, and we shall call this as cerebral embolus. Most commonly, embolus is seen in diseases of cardiovascular system. Hemorrhagic stroke. Hemorrhagic stroke occurs when there is break in a cerebral vessel or trauma, so blood leaks into certain areas of brain, leading to increased pressure in the skull, or we can say cranial cavity. This increased pressure will compress the cerebral tissue and blood flow to more distal areas. So, what are the causes of hemorrhagic stroke? If the history is non-traumatic and spontaneous hemorrhage has occurred in the cranial cavity, it is most likely because of the rupture of the blood vessels that were already weakened by atherosclerosis. Another cause of hemorrhagic stroke can be subarachnoid hemorrhage, which occurs when there is rupture of saccular or berry aneurysm. This rupture into subarachnoid space causes hemorrhagic stroke. Another cause for this type of stroke is malformation of blood vessels of the brain since the birth itself, that is, it may be a congenital defect that leads to hemorrhagic stroke. However, most of the cases of hemorrhagic strokes are reported because of chronic hypertension. Now that you know risk factors and types of strokes, let's see what happens when a brain strokes. Let's investigate the pathophysiology. In the ischemic core tissue, as the flow of blood stops, the brain tissues are deprived of oxygen and glucose. Several minutes after deprivation, the neurons start to die in this region. But what happens to the surrounding tissues or penumbra? These neurons will survive slightly longer than the ischemic core. To save these cells for longer time, the blood flow must be resumed. At least 20 to 25% of regular blood flow should be resumed. If the surrounding cells die because of ischemia, a series of events or cascade is triggered. Let's study this cascade in detail. The cascade begins by release of glutamate and aspartate. Next, this leads to disturbance of energy metabolism and anoxic depolarization. The brain is unable to produce energy, particularly ATP. There is excess influx of calcium ions that reacts with phospholipids and forms radicals. Calcium also stimulates release of nitric oxide and cytokines. Both these mechanisms further damage brain tissue. Another complication of stroke is cerebral edema. There is accumulation of fluid within the brain that begins minutes after the ischemic insult and lasts for up to 3 to 4 days, and this is commonly called as cerebral edema. This is a common occurrence in ischemic type of stroke. This fluid is nothing but result of tissue necrosis and movement of fluid from blood into brain tissues. Higher the edema, higher would be the intracranial pressure, which would compress the tissue and may cause shift of the structures caudally/inferiorly or contralaterally. Keep in mind that cerebral edema is a characteristic of large infarcts in middle cerebral artery and internal carotid artery. That is all for today. In the next video, we shall understand management categories and vascular syndromes. The references for today's video are provided in the description box. Like, comment and subscribe if you like the content.